Good morning. Very interesting case today. We'll be operating maxillary sinus polyp. Uh, this is a chronic inflammatory disease. Generally, in maxillary sinus, this occurs because of the infected roots of the maxillary teeth, particularly the molars. So here, the patient himself is a doctor. He had some old root canal done, and we are suspecting that there are some infection beyond the roots, and then that infection has caused the chronic inflammatory reaction into the maxillary sinus, and that causes slight enlargement into the sinus lining. So maxillary sinus also has a mucosal lining like the gums inside the mouth, and this mucosal lining do react to this infection, chronic infection, in a way that it enlarges and become a ball-like structure, which is little thicker gum or thicker lining into the maxillary sinus. So normally these kind of polyps, they don't require treatment. They do get settled down automatically, or they remain there without any symptoms if the teeth are treated either by doing a root canal or by extracting them and replacing with implants or bridges, whatever. So basically, if the source of infection has been removed, these polyps do settle down without any symptom. Doctor here had a symptom. He had some stuffiness into the maxillary sinus and had discomfort of chronic sinusitis. The symptoms of chronic sinusitis are there is stuffiness, there is slight pain into the maxillary sinus. So because he had a symptom and the size of this polyp is quite big, we have decided to operate him under Caldwell Luc procedure. So this procedure is, we'll be operating him inside the mouth by giving incision inside the mouth and going into the sinus and cleaning the sinus. So in a simple term, this is cleaning the sinus by directly opening into it, removing this polyp and allowing the sinus to form more healthier tissue and more healthier lining. So once it is clean and this polyp has been removed, sinus will form a healthy layer inside and ultimately become a more healthier sinus. We're planning to treat his teeth later because he is not with me for a longer time, because right now there's a symptoms into the sinus. We're treating the sinus first, and ideally it should be simultaneous teeth treatment also. But we're just delaying it for some weeks and then we'll come back and treat his teeth. We're starting the surgery. Anesthesia has already been given. Thank you very much. We'll see you after the surgery.